Lessons from a Hep A outbreak. I reckon the Australian government's response to a recent Hepatitis A outbreak was pretty good, though I might be biased being an Aussie myself. What can we learn from the investigation and response? About Hepatitis A. Hepatitis A is a food-borne illness that causes liver inflammation and jaundice. Severe cases can cause death. It is highly contagious and can be spread person to person as well as through contaminated food and water. The infectious agent is the Hepatitis A virus, HAV. It gets into food through faecal contamination when people who are shedding the virus in their faeces do not wash their hands properly before handling food. Viral shedding happens even if the person does not have symptoms. The virus is inactivated by cooking, but not by freezing or freeze drying. An unusual food pathogen. There are three things that make the Hep A virus different from most other foodborne pathogens. 1. The average incubation period for Hepatitis A is 28 days. 4 weeks. If you get Hep A, it was definitely not from your last meal. Yes, it takes 4 weeks for symptoms to appear after being exposed to the Hepatitis A virus. 2. Hepatitis A is completely preventable. There's a safe and effective vaccine for Hepatitis A. 3. The Hepatitis A virus is notoriously difficult to isolate from contaminated food. The outbreak, investigation and response. Local authorities were alerted to a case of Hepatitis A in a person in June 2021. Most cases, 74%, of Hepatitis A in Australia are acquired overseas, but this person had not travelled. A sharp-eyed infectious disease specialist knew about an outbreak in England that had occurred earlier that year and that was linked to fresh medjool dates. The sick person recalled eating fresh dates. The virus from the sick person was genetically sequenced and found to be identical to the virus that had sickened people in England. Soon more people in Australia were showing symptoms of Hepatitis A. Their virus matched the genetic sequence of the first Australian patient. When they were questioned about what foods they had eaten, they also reported eating fresh dates. One person was able to recall the specific brand of dates, medjool. Australian authorities obtained an unopened box of medjool dates from an Australian supermarket and tested it. They found particles of Hepatitis A virus in the dates. On the 5th of August 2021, less than 2 months after the first illness, the dates were recalled and an importation hold was placed on further imports of dates from the same source. In total, only 6 people became ill. Learnings. The government report on this outbreak explains that someone within the government health system was aware of the Hep A outbreak of a few months prior in England and knew that the implicated food in the England outbreak was fresh medjool dates. The investigating authority listened to that person and asked the sick patient if they had eaten fresh dates and also got the fruit added to the National Epidemiological Questionnaire for Hepatitis A investigations. These actions meant that the next few cases could quickly be linked back to the same food. The third patient remembered the brand of dates they had eaten, and this allowed for samples of the food to be obtained while they were still in the shops. The recall was initiated in less than 2 months for a pathogen that has a 1-month incubation period. Prompt recalls dramatically reduced the number of people who were exposed to contaminated food. Only 6 people were affected in this outbreak. The report concludes that the international sharing of information about outbreaks was incredibly valuable in this investigation. It also says that it's good to be able to access genome sequences from other countries because this can speed up investigations. And minimally processed foods, including fresh dates, should continue to be regarded as high risk for Hepatitis A transmissions. Takeaways. As a food safety professional, staying up to date with food poisoning outbreaks in other countries can help to identify risks in your local food system. Knowledge is power. As a health official, listening to new information and acting quickly to incorporate it into processes like patient questionnaires can limit the size of outbreaks. As a consumer, Eating minimally processed fruits from countries with endemic hepatitis A could expose you to food-borne illness. Hep A is preventable with safe, effective vaccines. I've included all the links to both the government report and the academic links in the email.